So I was just invited a day or two ago to join our parade of centers, and I'm really happy to be part of it now. This actually is our first month of LCN status, and we have not yet had our first clinic. So I'll be talking about our ideas and our hopes, but next year I'll be able to give you an update as to what we've actually accomplished. Our contact information here is leukodystrophy@nationwidechildrens.org. Should be pretty easy to remember. We've actually already started getting some inquiries as soon as we set up the website. And if you email this, it goes to our coordinator, to myself, and to our administrative assistant. So next slide. So just as a reminder, Columbus is in the center of Ohio. We're the only children's hospital in the center of Ohio, but we also have a very large catchment area. We regularly get patients from West Virginia, Kentucky, Western Pennsylvania, and occasionally from Michigan and Indiana. We have a facility on the left. That tower is our main inpatient tower that opened just a few years ago, thanks to a generous grant from Nationwide Insurance. But behind that extends the rest of our campus with research buildings and outpatient care. One of our motto at Nationwide is, when your child needs a hospital, everything matters. And I really feel that coming to work every day. You can see to the right, like many other children's hospitals, it's just a fun place to walk around in. So this is our magic forest. There's a coffee and ice cream shop there. If you're ever in the area, stop by. It's really fun. Depending on what time of day you're there, you can hear birds chirping that would be in the wild, chirping at whatever time of day you arrive. We are nationally ranked as a children's hospital, as well as a neurology division. Next slide. So we are building it. We have quite a few patients in our system, about a third of whom I already see. The rest are distributed among some of our other 35 neurologists and geneticists. And we're in the process of reaching out to those other patients to funnel them into our clinic when it does start. We'll be starting with a half day per month in September, and we have full administrative support to expand that as we do engage more patients. We've built a multidisciplinary team that's really going to focus on the care of the entire family. We'll offer same-day appointments with physical medicine, but they have a different clinic space where they have, physical therapy rooms and things like that. Because we do have patients that come from several states, it's a great resource to have a Ronald McDonald House right across the street. It's a really beautiful new facility with 137 rooms. And we have large training programs at Children's. We educate the next generation of pediatricians and neurologists, as well as we have genetics fellowships, genetic counselor fellowships, really the whole range of training programs. And already our first few clinics are already filled with learners. And so I'm really excited, particularly as the residency program director, to be able to offer that to our trainees. Nationwide is the children's hospital associated with the Ohio State University College of Medicine. And there is a very large neurology department, including an adult neurogenetics clinic there that we'll be able to transition our patients into. Next slide. So here's our team. Liz Lucas is a complex care pediatrician who will serve as our assistant director. She's boarded in pediatrics, internal medicine, and infectious diseases. So she rounds out a lot of medical knowledge that is not something that I access in my own brain every day. And so I think we're going to make a great team. Janice Moreland is a nurse practitioner who has quite a bit of experience in primary care and also several years of experience in neurology. She'll serve as our care coordinator. Natalie Truba is our psychologist who will be embedded in the clinic and visiting families every time they come. She has been our MDA clinic neurologist, so she's used to working with families whose children are affected by progressive neurologic disorders, and she'll be a great asset. We have a strong palliative care team, and I'm just highlighting here Natalie Jacobowski, who is also boarded in child psychiatry. And so she'll be instrumental in helping with some of the more complex behavioral aspects of our patients with leukodystrophies. And then Hema Rangarajan on the right is our transplant specialist who has been involved with me for our early infantile Krabbe cases, as well as transplant for adrenal leukodystrophy. And then our administrative assistants on the left, Christy and Stacy. We also have a social worker who will be embedded in the clinic, but I wasn't able to get her picture on short notice, but Hadley has been working with neurology for years, and she'll be kind of stationed in our clinic to touch base with all of our families and help coordinate, everything from community to supports to transition to adulthood to Make-A-Wish referrals. And then we have a genetic counselor identified. I'm just not supposed to say who it is yet. And so that'll be an exciting addition as well. So we have all the players in place to hopefully get off to a really great start. We plan to start small, but I do anticipate growing over time, and we have institutional support to do so, as well as access to all the different pediatric subspecialties that can make our patients' experiences the best possible. So I think that's the last slide, Anna.